80% of the chronic diseases can be managed if we manage our lifestyle, especially those 4 factors. And right now, over the last 5 years, I've turned vegan, completely off animal products. One of the things I got from turning animal products is, I'm in my mid-40s. I feel much more energetic, healthy and active than in my 20s and 30s.
So we have Dr. Rajeena Shahin next. She's a medical director for Physicians Association for Nutrition, and she's a co-founder and director of on Invest on Health Limited. She's going to speak on evidence-based nutrition intervention in healthcare.
Let's have some story here, which I came across during my practice. This is my family. This is how I changed nutrition, because I was working in clinical research as a project manager, then again a program manager, did MBA. I wanted to be in a flying job, going around the world. Then I had infertility issues. Actually, 7 years later, I got pregnant. Along with the pregnancy, my husband has been diagnosed with metabolic diseases. He was early 30s. And look at the weight. He was on 110 kg. He was traveling around the world. He was mostly in US and European countries. So he started eating all the junk food there. One of the days when I was pregnant, my mother-in-law came to look after me because I had some initial trouble. So he has gone to bring her home. And on the way back, he suddenly experienced chest pain. He was admitted in a hospital. He was 31, 32. We went ahead and did all the evaluation, and he was put on hypertensive medication. I think it was telmisartan or something. I don't exactly remember. Hyperuricemia and pre-diabetes. That they said, let's wait. And statin. Okay. And he was like 32, 33. And by the time our child was born, one of the days, he was on medication. He was like, life is not fair. He kept on saying, life is not fair and all. One of the days he was climbing up the stairs, and he decided, I'm only 33. There are people who are living 100. And in our family itself, there are people who are living 100. Why should I, yield in? Actually, he decided to make some changes. That was in 2012. And that time, I didn't have much nutrition knowledge, especially working in pharma industry. Some of the things which I knew was, as Dr. Sharma wisely put across, calorie density. So that's what we started working on. Going ahead with lower calorie, higher nutritious food. And definitely, there was calorie restriction. He lost weight. His parameters came back to normal. 8 months, he was completely out of medication. So he is not only lost weight, reversed his metabolic diseases, but also started looking younger. That time, actually, later part of few years, actually, we started learning a lot about lifestyle medicine. Few of the documentaries like Forks Over Knife and stuff. He started reducing his meat portion also. The meat portion reduction also gave him a feeling of kind of happiness, and he always had this anxiety and related things that came down actually. So he started believing in it. I started the same kind of diet, increasing the vegetable portion, increasing the fruit portion, some proteins, and reducing the refined grains. Actually, that's what I knew about that time, and there was huge change. And we decided that this is what we want to do. This is something, because it's a personal experience, we really got connected with the cause. And right now, over the last 5 years, I've turned vegan, completely off animal products. One of the things I got from turning animal products is, I always say everybody that, definitely I face problems, just like Dr. Sharon said. Protein deficiency causes problems because I was not aware how to manage my meals to get enough adequate proteins when I turned vegan. It was for a cause which I felt very deeply in. Suffering, anybody, humans or non-humans, suffering with something which I couldn't tolerate. I was not aware of this kind of cruelty and other things going on in the animal industry till I started watching some of these documentaries, which is Game Changers, Forks Over Knife, many of them actually. So then I started changing that actually. And as I said, the first thing which came to my mind is changing these things is disbelief. We always, as doctors, we believe that drug is the only way to treat a disease. Okay, we always believe that prevention Okay, definitely your lifestyle habit has factors, but we never believed that therapeutic lifestyle changes can bring in changes in the blood parameters of your disease. That was not there till then, actually. That moment in time, I decided that I want to dig deeper. And then a realization that nutrition is a really powerful tool to reverse, not only to prevent diseases, but to reverse diseases. But also then later understanding of planetary health and stuff. Now I'm a strong advocate of the cause. This is hierarchy of causality of chronic diseases, which is actually the image is taken from ResearchGate. It's a beautiful one. Look at the causes. There are distal causes, medial causes, proximal causes, and risk factors. We always say that we need to work on the root cause of the illness. How many of us are working on the root cause of the illness? Maybe in this room, there are a large number of doctors working on the root cause. But when I go and talk in a medical college or other areas, we don't see many people working on the root cause of the illness. They work on the risk factor. Risk factor is basically high blood pressure, dyslipidemia, any of those things. What do you give? You give a medication to bring down the risk factor. You're not working any of the cause factors, actually. So cause factor is basically your diet, your exercise pattern, or your social connectedness. But some of the conferences when I go and discuss, and I ask them, how many of you talk to your patients about diet? Very few. Okay. So what do they talk? The first thing they talk is reduce your quantity of food. Okay. Beyond that, and do exercise. Beyond that, most of the doctors don't have the knowledge about what Dr. Sharon said or Dr. Shaumin said. Am I correct? So this is something which PAN, as part of the firm which I am in, planning to bring or started to bringing in. And then this is definitely known to all of us. 80% of the chronic diseases can be managed if we manage our lifestyle, especially those 4 factors: unhealthy diet, physical inactivity, alcohol use, and smoking. It's actually known to all of us because even Harrison says the first thing of a disease management is lifestyle intervention. But it is, have you ever noticed, it's not discussing how to do that, right? How to implement that, how to even guide a patient about diet. Ma'am was asking, about how to change my diet. It's not talking about that, actually. That is the kind of skill set we need to develop in going forward. This is one of the reference studies which I get, cases which I get in our clinical practice. Again, I'm from Bangalore, so a woman, 40 plus, normally an IT professional or something. This woman, particularly a blogger, that too a health blogger. That's what actually I was talking about. Influencer. She's influencing people to take things which are not scientifically validated. She herself was taking around 4 small tetra packs of juices, which is called Tropicana. Okay. Thinking that it is giving a lot of micronutrients. Okay. And she is a vegetarian. And her protein source, because she felt that protein is very important, she was taking 5 servings of dairy, which has 2 servings of paneer, which is around 100 grams. Think about it. 100 grams of paneer is going to give you 36 grams of saturated fat. That part is not there. Only the protein, very skewed way of looking at things. And by the time she came, she was already diagnosed with metabolic syndrome. And her HbA1c was 13 or 13.5 or something. She was not ready to completely adapt. She felt like some people have made some changes, so she would try some of the things, but she was ready to go off all the packaged juice, started increasing some fruits and vegetables. But she was not ready to go off her dairy because she felt that's a calcium source. That's what, blogger, right? And the protein source. But after a month or 1.5 months, she started reducing it. By the time we took the test, the parameters were coming down. That gave her the confidence. She completely went off dairy and completely went off all the packaged and other stuff. Yeah, that's how, this is basically to understand that what was her problem, the cause, root cause. We understood the root cause. We put together a team. In the dietary course, these were the causes. I've already mentioned higher consumption of dairy, packaged juice, and highly fried items, which are all causing higher saturated fat, trans fat, sodium, sugar, TMAO. Ma'am was talking about Eat Lancet Commission. So higher consumption of these things and very low consumption of fiber, MUFA. We put together a team within 3 months. So this is the kind of pattern she followed by the end of 3 months. A lot of color, lots of nuts, seeds, legumes. You can see that. Maybe better picture is this. Ma'am, I think you can see the picture. And end of the month result, look at this, all in green. Where all were in, and her HbA1c was 5.5. Even the endocrinologist who was in Canada that at that moment in time, she couldn't believe. Hey, check it again. Maybe it could be something. She mentioned maybe it is a type 1 diabetes presented as something and all actually, but consistently the value is like this. Now it's 2 years. I mean, similar cases. This is one of the cases which you could do it in 3 months, where we always believe lifestyle take a lot of time. It doesn't all the time. It is just that, adaptation level. And this, I think, suboptimal diet is a major reason. This is most of you in this room must have seen this picture somewhere, at least in some presentations. It's always the lower things which is causing the problem. Inadequate intake of whole grains, legumes, nuts, seeds, vegetables, fruits, and then higher intake of saturated fat and salt and sugar. That's put across in this way. Even my daughter, ma'am, actually, my daughter is now 14. And she turned vegan. She was the first one turning vegan in my family. We were already on a whole food plant-based diet with a minimal thing after my husband's health incident. But then she decided to completely change it by 2019 after watching a few of the things. Because when you eat the food, you're not aware of the cruelty and the kind of things going on behind that food. When you start experiencing that through a movie or real life, you feel that, do you want to be part of it? So she changed it. And there are a lot of criticism from me, from my family, because she's not getting proteins, she's not getting calcium. And that moment in time, though we both are tall, I mean, my husband is also 186 centimeters. She was like short for a long time. And everybody said that you are depriving the child of the nutrition and she's not growing tall. My God, the kind of criticism we got was huge. But she stayed on. And I am in my mid-40s. I feel much more energetic, healthy and active than in my 20s and 30s. I feel there is a lot to do with plant-based diet than just weight loss or, PCOS changes, longevity, better aging, a lot of these stuff. When it comes to healthcare challenges, we don't think a detail about what we are facing today. Mortality and morbidity, 72% of the mortality globally is caused by NCDs. India it is 66%. And morbidity, the same thing. Food insecurity, undernutrition, again leading to food systems. NCD leading to food systems. Climate change. Major reason for climate change is also the same. Ma'am has already kind of told. So whatever we are facing as healthcare professionals, the challenges is actually boiling down to our food systems. Correct? So we need to change the food systems. Actually, if you're not part of this overall change, transformation, we are not going to be true doctors. As ma'am said, or others said, we need to be really being vocal about it. Create awareness about it, change each patient one at a time. Incremental changes, we need to bring that in. And this, I think this is the last one. This basically, so as everybody's in this room already spoken about it, we need a unified system, we need to change the food system, and we have a larger role to play. That's all it is, I think. Otherwise, we'll be doing this. There is a patient coming in, we're not addressing the root cause of the illness, we are actually trying to close the tap. That's all I think.